Good evening, sir. My name is Paige Alvarado. I'm going to be your nursing student today. I'm a bachelor's in nursing student. I'm going to be doing your assessment today. So when I first walk in the room, I'm going to pull the curtain for privacy. I'm going to wash my hands before any patient interaction. Can you tell me your first name?
Stephen.
And your date of birth?
04/27/89.
And what brings you to the clinic today?
I'm here for a physical for work.
Okay. I'm going to just ask you a few questions about your medical history. First, do you have any medical history? Asthma, heart problems, liver, kidney issues, diabetes?
No.
No,
Not
okay.
that I know of.
Any surgeries ever? Tonsils, wisdom teeth, appendix, gallbladder?
Nope.
No, okay. And do you have any allergies to food, medications, or environmental?
No, nothing that I know of.
Okay, do you take any medications on a daily basis?
No.
No, okay. And do you smoke, drink, do drugs?
No.
No, okay. And how about your exercise routine? Can you tell me a little bit about that?
I try to work out 3 to 5 times a week, and
For about how long each time?
about an hour to an hour and a half
Okay.
each time.
Okay. So this is a 27-year-old male who comes to the clinic for a routine physical for work. He appears well kept, well groomed. He is, his speech is clear, his mood is calm. I'm going to now move on to the physical assessment. So I'm going to start by inspecting his head and scalp. So I'm going to touch the head, look for any lesions, scars, bumps, moles, anything like that. I don't notice any. I'm also going to inspect his head and face for symmetry and make sure that everything appears symmetrical, which it does. Next, I'm going to look at the external characteristics of the eyes and look for any drainage or anything like that, and which I don't see any. Now I'm going to look at the external characteristics of the ears. The ears appear to be normal, and they're equally set on his face. I'm now going to do his pupillary responses, and I'm going to look to see how it reacts when the light is shined on it, and then how the other pupil reacts when the light is shined on the other one. Okay, just look straight at me. Okay. So his pupils are equal, round, reactive to light and accommodation. I'm now going to do the visual positions test. So I'm just going to have you look at my finger. You're going to follow my finger. Don't move your head. Okay, so visual fields are good. So cranial nerve 6 is intact. I'm going to move over to this side. Okay. I'm now going to test or look at his nostrils for patency. So I'm just going to look. Okay. Now I'm going to have you plump one side and breathe, and then do the same with the other. Okay. Nostrils are clear. I'm now going to move on to some of the other cranial nerves. The first one we're going to do is the gag reflex. And I'm going to also look at his uvula and his tonsils at the same time. I'm going to have you open your mouth. Okay, open your mouth. Uvula is midline. Tonsils are not red, swollen, or inflamed. Gag reflex is good, so cranial nerves 9 and 10 are intact as well. I'm now going to have you shut your eyes tightly. Scowl your forehead. You can open your eyes. Okay. Stick out your tongue. Puff out your cheeks. Clench your teeth really tight. Okay. Cranial nerve 7 is intact as well. I'm going to now have you stick out your tongue straight and then move it side to side. Okay. His tongue is symmetrical and he's able to move it easily. Cranial nerve 12 is intact as well. I'm now going to move on to the neck and inspect his neck for symmetry, and I'm also going to palpate for any enlarged lymph nodes or and palpate the trachea. Let me know if you have any tenderness or pain.
No.
Okay. Swallow. Okay. Trachea is midline and no lymph node swelling. I'm now going to auscultate the carotid arteries, so no need to just breathe normal. No brewing noted. I'm now going to move on to the abdomen. I'm going to have you lay down on the bench. So for the abdomen, first I'm going to inspect, and then I'm going to auscultate, and then I'm going to percuss, and then palpate, light and deep palpation. I'm going to have you lift your shirt up. So the first thing I'm looking for is any moles, lesions, scars, striae. There's a bit of striae noted, but other than that, abdomen appears symmetrical and without any lesions. So I'm now going to auscultate all quadrants. Vowel sounds are normal active in all 4 quadrants. I'm now going to percuss all 4 quadrants as well. Okay. And I'm now going to do light and deep palpation. This is looking for any abdominal tenderness in any spots and any organomegaly. Let me know if you have any tenderness at all. Anything?
No.
Okay. And now I'm going to do deep palpation, seeing if I can feel the edges of the liver or the spleen. So no organomegaly noted. I'm now going to have you sit up. And I'm going to look for any CVA tenderness. So I'm going to pat your back, and you let me know if you have any pain at all. Any pain?
No.
Any pain?
No.
Okay. Now I'm going to move on to neuromuscular and test his deep tendon reflexes. The first one that I'm going to do is going to be upper. So just relax your arm, and I'm going to do brachial first. Okay. Just relax your arm. And now I'm going to do patellar and Achilles. Okay, just relax your leg. And relax your foot. Reflexes are 2+. I'm now going to do range of motion, and we're going to start with the upper. So I'm going to have you put your arms across, out, up, and then behind you. Okay, range of motion in upper extremities is good. I'm going to have you lay down. We're going to do lower extremity range of motion. And I'm going to have you bend your legs. Okay, now just relax, open one, and then into the middle. Okay, and then bring it back, and then straight up, legs straight up. Okay, and do the same with the other leg. Relax this one down, bring it up, perfect, in, back, and then straight up. And I'm going to have you put your legs both straight, and open and close. Okay. Range of motion in lower extremities is good as well. I am now going to do the Romberg test. We're gonna look for swaying, so I'm gonna go ahead and have you stand up. I'm gonna have him close his eyes, stand straight, hands to your side, and just look straight ahead. No swaying is noted. Now I'm gonna have you close your eyes with the same stance, feet together, perfect. And no swaying is noted, Romberg test is negative. I'm gonna have him go ahead and walk and note his gait. His gait is steady, then turn around. Okay. I'm gonna also inspect his spine. Go ahead and bend down, okay, and back up. And I'm gonna look for the spine symmetry, no lesions, no anything noted. Go ahead and sit down. I'm gonna now test his upper extremities against resistance. So I'm gonna have you push my hands away, okay, and then pull back, okay, and then squeeze my hands. This is testing for grip. Grip is equal bilaterally. So just to recap, this is a 27-year-old male who presents to the clinic for a routine physical. Head to toe has been performed. Everything looks negative, and he appears that he can return to work with no restrictions. And I would wash my hands and pull my curtain and thank him for his time.